Hello, this is Dr. Gay from First Lake MRI, and this is a 25-year-old female who has knee pain. She has no recent injury, but she's had injuries years ago, and the doctor thought she may have an injury of her meniscus. And on this view here, we see she has something even worse. This is an ACL tear. This is the femur coming down, the tibia below, and the anterior cruciate ligament, or the ACL, comes down obliquely like this. We should see a dark band coming obliquely. This is called the PCL, or the posterior cruciate ligament, going the opposite direction. They make like an X. PCL goes this way, the ACL goes this way, and we see the top half of this is missing. So the ACL is torn, and this part of the ACL is dropped down. Normally it's more vertical, coming up like this. So this is a torn ACL, looks like an old tear, dropped down. And so the radiologist, thank God not me who read it, mentioned the ACL but forgot to really look carefully at the other things. So this is a very common thing. It's happened to me too many times. Don't even like to think about how many times. But we'll find a finding like this and say, hey, they got the ACL tear, we're done. And then your sensitivity to look at other things drops a little bit. But in this patient, they also had a tear of a meniscus. So this is the lateral meniscus here, the front and back looking normal. And if we go towards the medial side through the knee, we see there's also a tear right here of the medial meniscus. That little piece there is a tiny little meniscus fragment that's displaced inwards, but very hard to see. It looks pretty normal on this one. Here's the back and the front. On this one, it looks pretty normal front and back. So in case, unless you slow down and really be careful, you can miss this, what we call a bucket handle tear. This is a piece of the meniscus in the middle of the knee joint. So a bucket handle tear in addition to the ACL tear. And again, once the doctor saw this, he thought, yep, we got the finding, I'm all done, and didn't really look super carefully at the other part. But there's that little bitty meniscus fragment. And on this one, we're looking straight at the knee. This is the meniscus tear. This little piece of the meniscus should be over here, but it's displaced into the joint. If we look straight on at this, this looks like a pretty normal medial meniscus, but actually it's too small. This is the lateral meniscus. They should be roughly equal, but you can see the medial meniscus is smaller, so a piece of that is torn and displaced inwards, but there's no well-defined defect. It looks pretty morphologically normal, just small, so super easy to jog past. And in retrospect, this is that little meniscus fragment here in the middle of the knee right there, bucket handle fragment. On this view, we have a little bit of fluid back here. This is a popliteal cyst, or leaking fluid from the knee behind. And in this view, this is called an axial view. We can also see that bucket handle tear, not as well, but this is the front of the knee, back of the knee. This is the lateral meniscus, this round ring going around here is the front, side, back. And the medial meniscus, this is the outside, but a piece of that is displaced inwards. This little fragment is displaced inward like a bucket handle that you'd hold. And so they can take these and put them back over here and try to sew them back together, or sometimes they'll just take them and remove them. So a bucket handle tear that was jogged past because of the happy eyes. The patient had the ACL tear and then stopped looking. So very, very common thing that happens to all radiologists. And thank you very much.